Hello everyone, and welcome to this audio podcast. As part of a Bostix Titus issue, an audio podcast as part of another analytical storm, an audio podcast as part of a giant storm, and an audio podcast as part of a storm Bostix production. In this audio podcast, there'll be a basis in around the aims and objectives of this some aims and objectives in around uh, uh, some um, um, some peer reviewed some peer review works, some peer review sort of collaborative works, but wherein uh, wherein uh, wherein wherein as part of as mentioned as part of the as part of the synopsis in around this series, there have been further discussions with UNOS in the United States, and so thus as part of this audio podcast to highlight some aims and objectives in around some aims and objectives of original drafted works. So healthcare information seeking behavior of patients or recipients is important to understand, since much of the much of healthcare conditions or healthcare conditions can focus on specific medical and scientific terminology, and therefore patients require require the sort of a ba- require require resources to help navigate, understanding, and communicate with different healthcare professionals. Given the significant consequences to patients' health, health and economic impacts on healthcare on healthcare systems, it is important to understand health information seeking behavior to ensure patients are provided with accurate information that will improve knowledge surrounding health and disease. So the aims and objectives of some original works was thus: number one, to understand which topics and subjects are most important to those suffering in around this particular condition. To understand, number two, to understand whether retrospectively there has been a neglect between education and as part of healthcare delivery in context of the physical realm, and if tech can help join up the sort of join up the per join up the proverbial pieces. And number three, to understand which topics health professionals or service users and patients or service providers and service users or patients and professionals would find helpful. Number four, to understand what education should be made part of a care, a sort of a medical, a clinical, and a medical, clinical sort of disease pathway, and understand how healthcare and education for patients could be more integrated to so patients or service users feel more empowered, and research surrounding at the same time research surrounding information needs and seeking educational support, support from 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 patients through peer support groups or social media platforms, at sort of for at least in part is somewhat false positive. This UK investigation, or this UK study sought to seek to provide or sought to provide an understanding surrounding health information gaps, and proposes that patients between adult and pediatric populations, or young people's populations, require educational support as part of the clinical medical care pathways, and relating and regarding to the sort of disease classifications and severity. So thank you for tuning in on this audio podcast, and this audio podcast as part of the Bostix Titus issue. This audio podcast as part of an Analytical SZtorm, and this audio podcast as part of a SZtorm Bostix production, and the subsequent audio podcasts in this series will delve into looking at sort of the aspects around the methodology, and then some other aspects around this audio podcast series, however, before delving into subsequent aspects, there will be an interlude. Thank you again for tuning in on this Bostix Titus issue.